My name is Jomo Alokoye Simmons. I'm a holistic medical physician. Primary modality of practice is acupuncture, which I've been doing for 16 years now. And I utilize several other modalities, dietary therapy, massage therapy. My primary focus is around preventive care, helping to keep people healthy. But I specialize in physical and psychological, emotional trauma, digestive issues, chronic conditions. I'm born in Harlem, but raised in the Bronx and Brooklyn. So all three of those boroughs are my home, but Brooklyn is like my community in a different way. That's my roots. Harlem still has largely a Black American population. Brooklyn actually has so many different communities. You know, you can go to East New York, Brownsville, and there'd be one part of the diaspora. Go to Crowns Heights, Flatbush, be a whole nother different part of the diaspora versus Bed-Stuy or Stuyvesant Heights or Fort Greene. What I saw, the primary factor that I saw, or primary condition that I saw, was challenges with food. That's what's most visible because in Harlem, there still were not stores that provided healthy options. It's a lot of food deserts still. Brooklyn actually had a lot more variety because of the Caribbean influence in communities in Brooklyn. So there was a relationship that had changed in Harlem. Gentrification hit Harlem really hard, and a lot of the Korean markets that were in Harlem left. So all these different types of plants and vegetables that you can find in Brooklyn were not so available in Harlem anymore. And then I'd say the other part, which is really, really significant, and I'm very, very mindful of what I'm about to say because I've gotten a lot of feedback in the past about it, but the nature of the food that we ate could either be something that comes out of what I would call the colonial system, where we had to eat a lot of staple crops that were just going to get us through working in the fields, potatoes, porridge, bread, things that are just going to give us the energy to work in the field, and a little bit of meat. That changes when you're not working in the field and using your body and instead sitting at a desk. So those three factors, the regions that folks are coming from, the capacity to afford the food that's going to be beneficial, and the knowledge of how that food is used and passed forward in generations. Now you have folks who are more sedentary, who are not as active. The most activity may be walking to the train and coming home from the train to go to work. And what happens is you have obesity that starts to develop, diabetes that starts to develop or gets passed on into generations. And then those are coupled with things that aren't so seen. So the seen would be mainly obesity and diabetes. The unseen things are the psychological and emotional traumas that get passed on through generations. So these are the things that patients will talk about. And they're very important because one could be working, individual could be working to, say, lose weight, or I won't even use the word lose weight, but make their body more healthy, right? But they're dealing with a lot of emotional baggage that they've inherited from their family line. So every time they make a step forward, mentally and emotionally, they're still here, even though they're trying to move their body forward. And so it's this back and forth, the back and forth. And as a result, they don't seem to make any progress. So for me as a practitioner, that awareness that I had about diet, about food, being a farmer also, having experience in farming, that gave me the capacity to but just really give a wider food selection and even give input as to where my patients could go and get food in the communities, because I was part of those communities. And then on the other end of it, I could address the hidden factors through conversation and as well as through acupuncture, holding space for that patient so that they can let some of that stuff, they could let some to a lot of it go over repeated sessions. And then they're able to now put something in because they now have space because they've let go of a lot of toxicity.